a disease of the mind. But I'm saying it is not mental health, or it's not mental illness. When we talk of the mental health, we say it is a state of being in a position that you are able to say this is good for you and this is not good for you. When you are able to distinguish between what is right and good, then we can say you are healthy. But there is a way that it is defined by the World Health Organization. They say it is a state of well-being in which one realizes that he or she has his own ability to help him cope with the normal situations of life. You are able to cope with some stressful situations. If you are able to cope with some mental situations, then you are healthy. If you are not able to cope with some situations that affect you and that it makes you more worse or it affects you and brings you down, then we say you have a problem with your mental health. So in mental health, there are a lot of things that people do talk about. Once I was in one of your churches. I was invited, and the church is towards Mzee Wanyama. It's called Lions. So I was told to just talk about mental health generally, but people got interested and they narrowed down to depression. Some people know about a problem that is called bipolar disorder. So they narrowed down to those two because we will have time to interact. So most of the questions that were brought to me were just from those two instances. But I can tell you that whoever has a problem with his mental state, like the youth here, some of them tend to abuse substances. There are drugs of abuse, and we also say that when you abuse something, it means you are not using that thing for an intended purpose. Hata chakula ukitumia kwa njia mbaya, utaambiwa you are abusing the food because you are not using it for an intended purpose. So those who are using drugs and they are misusing those drugs, we say they abuse those drugs because the drug is not used for a helpful purpose. So there are some common mental illnesses that I may just want to touch on. We have what is called anxiety. Anxiety, people become anxious. And when you are anxious to an extent that the anxiety you have gives you a problem, then you have an anxiety disorder. We have also depression. We also have substance use disorder. We also have personality disorder. We also have the bipolar. We have what is called panic attack disorder. We also have obsessive compulsive disorder. These are just but some of the common mental illnesses. And I know you've seen people with such problems. You've even seen some people who are walking, they are very unhealthy, and they fail to take care of themselves. Even in town here, I know you have walked and you have seen people just moving, some very fast, some talking to themselves, some carrying very heavy luggages, but they do not want to leave them down. Some have their clothes, and the clothes become their boxes. I know at home we have boxes where we keep our linen, but to them, everything is kept into their bodies. They carry everything, whether clean or dirty. Such people, some of them have what is called schizophrenia. I know schizophrenia is not common in our language. What is common in our language is depression and stress. Those are the things that we usually talk about. So and so has stress. Unaona vile amekaa, he has a lot of stress. At home we don't talk about schizophrenia because probably the word may not be found easily in Kiswahili. After the 2007 clashes, we also had people who had mental illnesses. And it was necessitated by the fear that came about with the clashes. One may have seen some people or close relatives being killed. People ran away because they knew they would be attacked. But some people developed, after 1 year, after a few months, they developed mental disorders. So they were traumatized in a way. So such ones, we say they have post-traumatic stress disorders. And it comes about after witnessing things that make you not become at ease. So it follows an occurrence which was so severe, which was painful, which you could not bear. We also have another one which was quite common some 2 years ago, before the COVID, that mostly it happened to young students of Standard 8, mostly some of them in Form 4. And what was the problem? Most of them became suicidal. So there is also suicide. Whoever commits suicide or whoever is talking about suicide is also having a mental disorder. It happened when students were being told to repeat classes. And they were saying, I'm not going to repeat that class. And if you tell me to repeat, nitajinyonga. And most of them did that. And the more it continued being aired, the more many of the students continued doing it because they were copying what the others had done. So I don't want to fault the media because that is news to them. People would want to know what killed who. But it was too bad. People became copycats. Mimi pia nitafanya kama vile nani alifanya. And these are people with poor coping mechanisms. We have signs that tell us that one so and so, Mr. Nyauche, is having a mental problem. And these signs we call them danger signs. And how do they look like? They are, one develops a prolonged loss of appetite. Somebody just says, mimi sitaki chakula. Kwa nini? Bado nimekasirika na ile maneno nilisikia huko. Vile nani alinifanyia, nasikia tu nimepoteza hamu ya kukula. And she goes on like that. When it becomes too much, then this person is almost developing what? A mental disorder. Some even get loss of sleep. That he was so annoyed in such a way that even if he goes to the bed, they don't sleep. This also happens to people with addiction, like those who are addicted to taking tea, those who are addicted to taking alcohol, When they suddenly stop, usingizi inapotea. Hata chai mtu akikosa kukunywa anapata nini? Lack of sleep. I'll tell you, it happened to me one time in 1994. Some people, when they are aggrieved or when they are affected, this is also another one of the signs that tell you that a person is developing a mental disorder, that they lose things that they loved, they now stop loving them. And that even they don't see life as worth living. Life becomes useless to them. So they are the people who can easily go and hang themselves. They can radiate to depression because life is not useful to them anymore. And when you see such a person, or when you hear of a person saying life is worthless, then that person is developing a mental disorder or has developed a mental disorder. Wengine or some have shifting goalposts of pain on their body. Mara kichwa inauma, imepotea imerudi kwa mgongo, imepotea imerudi kwa tumbo. Yaani hii ugonjwa yangu siwezi hata nikasema ni wapi ninaumwa. Tumbo, mgongo, kichwa, hata kifua. Such people have what is called anxiety. Some of them have developed depression and they don't know. So those are some of the signs of a mental disorder creeping into one's life. These people with shifting goalposts on their body, even what they used to do for the family, they tend to leave. You find that somebody was going on duty, amepata kazi. Like the COVID brought one of the things which is called stress. People were stopped from where they were working. And you see it was an abrupt stop. Wamama na watoto wengi wao wataambia baba, tunataka nini? Chakula. Some ladies will go as far as telling their spouses ya kwamba, unafanya nini kwa nyumba na wanaume wenzako wanatafuta kazi? Sasa umekaa hapa na sisi tutakula nini? Na watoto wanaambiwa, enda ambia baba yako akupee pesa. The baba doesn't have money because hata pesa ile aliwacha kwa kazi hajatumiwa. Mzee kazi yake itakuwa ni kulala tu. Ukimwamusha akienda kukaa pale chini anaangalia tu chini. What does he have? This person has something that affects his mind, and it has become so stressful to him that he cannot bear. The next thing is that you will find this person even talking to himself. You will find this person not even sleeping. You will find this person anaitika tu, si nimesikia mtu ameniita. They develop what we call in our language there hallucinations. Some cannot even sit and stay sitting the way you have seated. Since I started talking, some would have moved more than 10 times. They become a bit restless. And I can tell you a situation that yesterday I witnessed at hand. There is a mzee who died, but he died last week on a Friday that was preceding Monday, 14th. And on Monday he was buried. The wife was here in Nakuru. The person died in Kisumu. The children work in Kisumu. They took their father for treatment. So they knew the father was dead. They called the mother to come to Kisumu because baba aendelee mzuri. Mama kufika anapata bwana yake amekufa. The children could not understand that mama ameona watu wengi wamekufa, lakini baba akikufa sasa anakuwa wazimu. Since the husband was buried on the 14th, up to and including yesterday, that lady has not had a wink. Ajalala, usingizi ijaingia kwa macho. The last 4 days, after the husband was buried last week, she has developed queer behavior. Taking makaratasi, anaweka kwa bag, anatoa kwa bag, anatupa, anachukua vitu, anaturusha. When a colleague whom you invited and gave me the opportunity to come on his behalf is our psychiatrist. He said, the person that I can send to come go and do this ni mimi. So he sent me. I went and found the person was very restless. Mpaka wamefungiwa kwa bedroom yake. Kila kitu anachukua na rosha. No. She could not cope with the death of a loved one. And more so, a dear person to her. To the children, mama ameona watu wengi wanakufa, anawaambia poleni. No. When it comes to somebody else, you go and tell her, poleni, life is like that. Mungu anajua sababu ya kuchukua huyo mtu. God will fill the vacuum. Much as God will fill the vacuum, God will not bring back the husband. And the pain of losing a husband, the person who was providing for her, became unbearable, and she developed mental illness. So when we talk of a state of well-being during this COVID period, tunaona ya kwamba the lady was not given time to come to terms with the loss of the husband. Within 4 days amezikwa. 2 days, because in Kisumu it is 72 hours. So they had to transport the body to Nakuru, and they were told to bury within 72 hours. They came kwa shamba yake, wakachimba kaburi na wakamzika. The mother cannot comprehend being in the bedroom alone, because the boys and the girls, kama vile sisi naona kila mmoja wenu hapa ni adults. Tumewacha wazazi wetu, na sisi tutawachwa na watoto. Kila mtoto hako kwake. So mama will have to be there alone. It became too much unbearable for her. So when I talk of restlessness, it is not even, mtu hawezi tulia kidogo. Na it becomes too much for you until, hata ukikuja hapa unachukua simu, unarosha huko, unaenda pale unapiga simu teke, unachukua kitabu, unaingiza kwa bag. And the only thing she could now talk about when I talk to her, kwa nini mi bado ninaishi? Si hata mimi ningekufa tu. You see, it became too unbearable for her. So there are what we call stressful situations. And when one shows these signs, it means this person is severely affected. And there is also excessive alcohol intake. Kunywa pombe kupindukia. Like most of the people who stopped working because of COVID, and mostly the hotel industry, these people, most of them got into alcohol. Na wanasema wanafanya hivyo kwa sababu wanaondoa stress. And you remember, as people who come to the church, anybody who is intoxicated, hata wakisema wanaongea kuhusu biashara kule wanakunywa pombe, me I see as they are destroying themselves. Kwa sababu ukisha kunywa pombe akili inapotea, kulingana na mimi. So they take a lot of alcohol, wanatoa nguo, hata pesa wakiwa nayo, ukisha kuwa mgonjwa unatumia tu kiholela. Wengine wana develop what is called forgetfulness. Wanasahau too much. Na unampea pesa, tena anarudi kukuuliza, na ile pesa ulikuwa unipatie? Hajui. Why do they develop forgetfulness? Because the mind is already affected. And which people get affected in that way? Those who develop that problem which I was saying we don't usually talk about at home, called schizophrenia, and also those who take a lot of alcohol. It affects our thought. It affects our memory. So we don't remember. So alcohol consumption affects us so much. Hata kukaa na watu inakuwa ni shida. Because when you have a mental problem, coping becomes a problem. And I'm telling you, if you see somebody isolating himself, this person is already developing what is called a mental illness. Hizi zote dalili ya mental illness. Are we together? Yeah, and I will welcome questions. Hata kuoga, mtu anakosa kuoga. Na maji inakuwa baridi, hata ikichemushwa bado anaiogopa tu. Kwa sababu gani? Haoni haja ya kuoga. And they are looking for excuses to miss to bathe. Whoever has a question anaweza andika. I want to come to the do's and the don'ts of COVID-19. Talk about stress. I was teaching a group of people. There was a program called, and I know some of you may have heard about it. We called it PM+. It was a psychological well-being or psychological management of people affected by mostly stress. So anybody who is affected by what we call adversity, hata ukiona vile watu wanauliwa kama wakati wa 2008, that is an adversity. If you cannot accept that that can happen to anybody else, then we say you are overcome by stress. And that is one of the things that was brought about by the COVID pandemic. Stress befell many. And in fact, those who got that stress, those who got stressed up, most of them became mentally sick. Even separation that was brought about by those who were affected by the COVID-19 brought trauma to some people. When you move towards the western part of Nakuru, I would say Ronda, I would say Kaptembwa, I would say even Mwariki down there, people live from hand to mouth, isn't it? People tend to go to work, and after work they get what to come and eat. Even those who sell their goods in town could not get time to sell them properly. And once you fail to get your daily income, what sets in? Stress. Because you cannot now see how you are going to fill the gap that has been created by loss of an income. So tunaambiwa hapa, at first we must acknowledge that feeling stressed is a normal response to an abnormal situation. Once you accept that it is a reaction to an abnormal situation, then you are told, what do you do next? We have to look for what to do next. Because once this avenue is closed, then we have to look for another avenue to get our what? Our income, or to earn our what? Our daily living. But if we sit down and say that COVID has come, then we cannot go and look for a job. And in fact, it has become an excuse in many people. Ukiambia mtu, hata sadaka, utaona watu wanakosa kutoa sadaka wakiblame nini? COVID. Ati COVID is there. Si hata malaria iko. Ama namna gani ndugu zangu? Malaria is there with us and it kills people. But people need to come to church. People need to do what? To even produce their tithes and sadakas. Because what God has given you, you must appreciate that God has given you something. Don't live in denial that there is COVID. And in fact, somebody who is also living in denial that there is COVID, that person is also mentally sick. That is mine now. That is not for the government. Somebody who is living in denial and failing to appreciate that you can work yourself out of a situation that is crippling you. If you don't appreciate that, then you are mentally sick because you are living in denial. In fact, most of our patients up there, unamwambia you are sick, anakuambia I'm not sick. Ni wapi niko mgonjwa? Because their thinking is distorted. Wengine wengi nayo wamekuwa affected in their mind by the COVID-19. So if you cannot cope with the situation, if you don't accept that it is there and there is a way out of it, and a way out of it brings me to the do's which Brother Walter told me to come and talk about. Now, when I came to the gate, I found sanitizing equipments outside there, or washing hand equipments, isn't it? Whoever is just coming in here without washing his or her hands, akili yake ni timamu, hata akikuja kanisa hapa, he's rebelling. Yeah? And this person who is rebelling is not mentally stable because they don't understand a simple thing that is being told to us every day. They don't appreciate the effort of the government that they want to minimize the COVID infection. Research found out that you must, when you wash your hand, you limit chances of getting what? COVID. When we avoid the handshake, we are minimizing the chances of getting COVID. When we keep the social distance like the way you are conforming here, we minimize the risk of getting COVID. And if you accept, you will remain healthy. If you don't accept, even your conscience is going to fight you when you go back home, unless your conscience is dead. And when it is dead, then we say you don't have the authority over your mind. So whether you think abnormally, you take it to be the right way. That is why we have to accept, come to terms with whatever is taking place. That COVID is present with us and we must do what is expected of us. So what we must do, we must have a mask. I'm alone here. That's why you can see me removing it. I'm not going to infect anybody here. We must wear masks. We must not touch our eyes. Because hapa we have what is called a mucous membrane, and it is the most easily affected part. Even in our mouth, this is a mucous membrane. It is also very easily affected. even our noses. But I know, one may start thinking, na kwa nini hatufungi macho if the eye can make us be infected? We want you to move from one place to another. And your eyes cannot spit what do you call it? Hii maji iko kwa macho hii. Haiwezi ikarusha, ama inaweza? Na mdomo itafanya nini? Itatema mate, si ndio? Mapua nayo itafanya nini? Isn't it? So that's why we cover our mouth, and because some people are careless, they spit carelessly, aimlessly. Even when you sneeze, see things come out of our noses, even our mouth. That's why we have to cover our mouth. But even if you cover your eyes and you are comfortable, you can walk, you can do everything normally without a problem, appreciated. So, what we need to do, we need to educate ourselves on the events that can help us make informed decisions. What are these events? Overcrowding. Kama saa hii tunaambiwa watu wamepigana Kisumu huko, watu wamepigana sijui Bondo, because they do not want to hear. And what are we told? Don't overcrowd. Sindio? If you overcrowd, then you are offending the government. And the government will work on you. Like some of them wamerushiwa tear gas. Kwa sababu gani? Wamekataa kutii. So what we are expected to do is not to overcrowd. We give spaces like we have done. That one is expected of us. We are also expected to have some recreation. Get time to do exercises. Because when you sit too much, you start thinking too much. When you tend to do some exercises, you divert your attention from whatever was disturbing you, and then you concentrate on the exercise you are doing. I remember when COVID was at its peak during the first pandemic, waliopatwa na hiyo shida walikuwa wanafanya exercises because not all of them were on oxygen. Walikuwa wanafanya exercises where they were to distract them from thinking about what they have lost, to distract them from thinking about how their families are going to eat, which of course with families how they are going to eat. Lakini each man was created, na kila mtu aliambiwa afanye kazi na mikono yake, sio mkono ya mwenzake. So God will feel if you am stopped from doing this, then God creates another avenue. Like the business people, they were crying, biashara imeenda, biashara imeenda. Saa hizi watu wanatengeneza the masks. They are selling the masks. They are earning from that. You diversify. We are also expected, or one is also expected to stay in contact with their relatives, even when you are quarantined, even when you are told not to be moving from place to place. Stay tuned. And how do you stay tuned? Piga simu. I know the question that is going to come, nitapiga simu na nini? Simu zingine hakuna the social applications. Kama WhatsApp, you cannot read what is happening. Like, I know people have known what is happening in Kisumu and Siaya now. But if you can, tafadhali fanya hivyo. There is also another thing which we can keep ourselves busy with. Read your Bible. Because it is said the best book to read is what? The Bible. And any sanity person, yeyote yule akili yake iko timamu, atatumia Biblia kama chombo cha to soothe the souls. Those are things that we are expected not to live, but we are expected to do them. So read that Bible, engage in healthy communication, do the exercises, avoid taking alcohol, avoid taking things that will make you not to sleep at the time when you are supposed to sleep. And if you do that, we say you have maintained a mental health, well-being. If you refuse to do, then we need to talk to you. We have many people who can talk to people, to those who are deviating from the normal. So, si tuko na hata watoto wa shule, we even advise them and encourage them to do what? Their homeworks and finish. If they cannot concentrate and finish, then we say they must have a problem, because they have a problem called concentrating. So we say, finish your homework. Any activity that you start to do. In fact, we advise people to even go to the shambas, if you can have one, ata within the compound where you are. And in fact, another thing is, hata kutengeneza nyumba kukua safi sio kazi ya wamama peke yao. If you can see that mama hajatengeneza hii na ni mbaya, why don't you make it good? In fact, this is my theory and my policy. Man was created to do the job. The wife or the woman was created to help the man. And if for anything, ladies, you are given one thing that you will never ever miss to get. Hata mukienda hospitali, hamutakosa ya kwamba mukipata watoto lazima musikie uchungu. Hiyo ni lazima. And that's what you are given. When man defied God in the Garden of Eden, the repercussion that was given to man, that man has to work and sweat to do what? To eat. It is in Genesis. Man has to work to get his food, and he must sweat. What was given to the women? Ya kwamba ukipata mtoto lazima usikie uchungu. And I once got some ladies. Kuna mama mwingine alikuwa akipata mtoto yeye anapasuliwa. Mwingine naye alikuwa akitaka kupata mtoto anasema lazima adungwe shindano huko, hiyo uchungu asifanye nini? Asisikie. But most of the ladies, what do they say? Hata na mimi nataka kusikia ile uchungu wa mama wanafanyaka nini? Ndio nijue nimezaa. Na sisi wale tuko hospitali tunasema hata ukipasuliwa hapa mtoto atoke umezaa. Sini mbegu yako. Lakini still the ladies would want to get to give birth the normal way that was given to us by God at the beginning. Sababu Mungu tu ndiye angeweza kufanya operation during that time. Na alifanyia mtu mmoja kuthibitisha ya kwamba ni yeye anaweza fanya operation. Wakati Adam was alone, he gave deep sleep to him. Akafanya upasuaji, akatoa mbavu, akatengeneza naye msaidizi wake. See, that's what we read. The equipment he used to do that operation, we don't want to ask God. Mtu aoge, mtu akule chakula ambaye inaweza kumsaidia kwa mwili yake kwa njia nzuri. So, we are told that we encourage people to think properly and don't get distracted by the illness that they have. Ya kwamba, sasa nimepata hii shida, nitapona kweli. Don't think of nitapona kweli. If you have not died and you continue having it, thank God and say that God has taken good care of me and I want to continue thanking him every day immediately I wake up. Hata ukiamuka usiku omba Mungu, that is one of the things that you are supposed to do to thank God. And once you do that, you will find yourself healthy. Hauna deni ya kusema nini? Ya kusema ya kwamba si kuambia Mungu asante. Anybody who is mentally healthy appreciates. And one way of appreciating is to say, thank you. And where do we take our thank you? Thank you, Lord. Exercises are supposed to be there. We need to talk to our people. When you have a problem, those are one of the do's. Go to my brother here, share with him your problem. Always when I was young, or when I was in secondary, I was taught something, that a problem shared is halfway solved. So when I come to my brother and share about my problem, I'll get a bit relieved. Even if he doesn't give me the answer immediately, I'll get relieved. That is normal. When I keep to myself that ile kitu ilifanyika, hiyo sitawahi ambia mtu, it will keep haunting you until such a time that you even become depressed. Later on, unakuja kusema 1, 2, 3 happened in my life. And people will tell you, oh, that's why you usually keep to yourself. Ni kwa sababu utoangi maneno ambaye inakusumbua. Na watu kama hao wanapata ile ugonjwa ya kisonona. What is it in English? Depression. Because they usually keep to themselves. If you talk about your problem, you keep on getting the answer. And you choose the best answer that will help you come out of the problems. It is you who has to make an informed decision that this is the one that is going to help me. After consulting 1, 2, 3 people. So talking to trusted people always removes what? Anxiety, it removes boredom, it removes fear, and it makes you not fall down into depression. Ukiwa na shida, what you need to do, or what people need to do during this time of the pandemic, when you have a problem, talk to your family members. These people always have a solution. When you talk of a problem that you have encountered, there must have been somebody who may have encountered the problem and he has come out of the problem. So you will get a solution from there. But when you keep to yourself, utawaza na utawaza, usingizi itapotea, hamu ya kukula itapotea, kwa sababu you are thinking about a problem that you cannot overcome. Another thing that we can do, for those of us who got the opportunity to at least attend school, write about your experiences. Share your experiences with others. And once you do that, you remain happy that people have known what I'm thinking, that I did not keep to myself. And when you finish after you write, help me overcome the problem. And when you do that, when are we supposed to stop? Okay. It is 4:10, But when you do that, you will get a solution. You will remain healthy in your mind. And in your heart, you will not be disturbed. Ya kwamba sijafanya hivi. And once you do something and succeed, you will be happy. And you will continue thinking of doing another thing. An impediment that will be ahead of you, you will continue doing what? Looking for a solution on how to overcome it. There is also what we are not expected to do, that we don't expose ourselves to stressful news. Ya kwamba mtu alikatwa mpaka akakufa, and you want to dig deep into that. If you have a poor coping mechanism, I tell you, siku hiyo hutalala. Na usipolala kwa sababu ya hiyo, kesho nani amekwambia utalala? Still you will continue having the same problem. And when you don't sleep for quite some time, you develop that fear. And once you develop the fear, you will start running away and screaming. And when you do that, wenye wanakujua wakikupata watasema nini? Umechizi. Na watakukimbiza wapi? Medical. So even the news that we watch, like the ones that we were seeing from India, like the ones we were seeing, like people are dying in Brazil until those who are buried are now being removed to give space for those who are dying now. The question that one asks himself, na wale wamefukuliwa watapelekwa wapi? You start thinking about what is going to happen to them until you will not get the answer. And when you don't get the answer, it disturbs you. I saw a horrific picture. It has not left me in peace. Select what you can watch. Even in the social media, I was being told by a certain person today, ya kwamba unaniambia ati ninaweza andika maneno yangu kwa social media. You know, those people really bash people. Unfortunately or fortunately, me, I don't know how to work with Facebook. I don't know completely, and it is not in my phone. Number one, I took it kama jela, because I was seeing those who were in Facebook always when they walk phone. Aoni hata mali anaenda kukanyaga, anaangalia tu simu. That is when Facebook came. And I said, I do not want to be in this prison. Somebody was buried the other day. Na akawacha alikosana na bibi yake na akasema kukuwa na bibi ni jela. I also take him as somebody who had some mental disorder because he was deviating from normal. Kukosana mpaka unaona mwenzako anastahili kukufa, you don't even want to see that person is abnormal, because we need to develop coping mechanisms. And in the Bible, we need to have what is called forgiveness. Ama namna gani? But he chose that path. So, do not devote your time to the news or television or social media that have a negative impact or effect on your mood. Yeah, I've talked about that. Don't ignore the signs. If you see someone or yourself or somebody close to you who is spending a lot of time in taking alcohol, or someone doing something that is quite emotional that will affect them, and you stop to ukose kumwambia ama ukose kutake action, because this person ataendelea hivyo mpaka aumie kabisa. So when we see some people are stressed mpaka wanafika mahali wanaongea peke yao, tusikose kuwaongelesha. Let us give time for them. But if you leave them, you have aggravated their problems. Don't let a person you love or somebody you know start isolating him or herself. Ya kwamba siku hizi anakaa tu peke yake, and you say it is normal. That, nani siku hizi amependa tu kukaa hivyo. No, it is not normal. And when you see somebody or somebody you love isolating himself or herself, hata kama ni mtoto, hata kama ni mtu mzima, get to know. Don't let this person continue like that, because it is detrimental to their well-being. And it is difficult to treat them, because, can I tell you one thing? That somebody who is affected by mental illness, we have an average time for them to get better as 21 days, 3 weeks. Why do I talk like this? These drugs work slowly, and mostly this depression that people know, the drugs work within a period of 14 days. So that's when you start seeing some little changes. And within that period, if you are separated from your loved ones, economically, you will be disturbed. Kwa sababu gani? Saa ile unawacha kuenda kumwona hospitali, useful hours will have been lost. You will have distracted yourself. Kama ni kijana, kama ni baba, kama ni mama, people will be stressed. Na mama atakuwa na shida kujibu swali mingi kwa watoto. Baba atakuja siku gani? So that's one of the cardinal questions. And you must answer them. Like this my young boy here. They want to know. Atakuja siku gani? And you must tell them ile ugonjwa ako naye. Don't let people get indulged into taking a lot of alcohol to remove their stress. If you see somebody doing that, tafadhali, mwambie, you are destroying yourself more than you think you are helping yourself. Because when you come out of that alcohol, does the problem go away? It will not. So we are told many people went into drinking to camouflage, ama kuzuia kuona that they cannot put food on their table. Ya kukunywa pombe iko, lakini ya kukula afanye nini? Hakuna. So you find somebody drinking excessively, ya kwamba amepoteza kazi. But I can tell you, this is outside this. Ya kwamba whoever has gone to school up to and including standard 8, this person can do a business. Sio lazima uajiriwe. Because hata wamama wetu, wengine wao hawakuenda shule, but they still managed some business. Up to standard 8, you know how to do the simple mathematics of giving back the change. You can only cry to get the capital. Tafadhali. The little we are getting, let us use it prudently. Tusifanye ya kwamba that this one anaona mbele imefunikwa. Kwa hivyo sitaki kumaliza hii pesa, sasa ile nitakuwa ninaulizwa pesa nikunywe pombe nikirudi nyumbani, narudi kama wanasema amelewa. No, we don't want that. And I know in every situation it is not acceptable. Usiseme wewe ni useless. Some people say so and so has become useless. I want to read one statement here. Making time to unwind and remind oneself that strong feelings are tolerable and will fade. Accept instead of suppressing emotion. Ride the wave. Ukijaribu kufinya the feeling that you have, ya kwamba hii nitafanya namna gani, this is beyond me, alafu unaenda kukunywa pombe, unapotea kutoka nyumbani ati umeenda kuhang out na watu with friends, you don't know how the children are, because you will be asked to give some money to give them food. You are not helping the situation. What are you doing? You are worsening it. As much as you may be feeling ya kwamba a day has gone, the people you have left behind, whom you are blaming the COVID-19 for, kama watoto, mama hatakuwa na peace, kwa sababu the children don't know how to fend for themselves. Wataambia mama, nasikia njaa. Mama naye will throw emotions. Si baba yenu ameenda kutembea kutangatanga. Things like that. Na children wanajiuliza kutangatanga ni nini? And they would want to know more about ya kutangatanga. Alafu baadaye, they say, when I become big, I will also tangatanga, nisilete chakula, na nikule pesa yangu peke yangu. Are you seeing those things? So, those are some of the things that we tend to say, let us not run away from our problems. Because when we run away from them, like shifting negative self-statements to statements that allow one to function with less distress, that's what we are supposed to do. And what are they? Try changing this word. This time it is terrible. To this time is a terrible time, and but I must get through it. This time it is terrible. Yani, you cannot go out of it. Change that statement to say, this is a terrible time. And because you believe in yourself, you say, I will come out of it. And when you come out of that, I think you will be happy. And when you get happy, emotionally or mentally, you will be satisfied and you will be happy and you will start thinking of how to overcome another one. Unless there is a question, I beg to hold. Maybe I can react to questions.
Those with questions, you can come up front, you use the mic, then you can ask your questions. But there's some 3 questions here.
Yes.
From a friend, which I think you have answered, but it is good that I can ask as he has asked. What are the simple ways for us to be mentally well, or what can we do to prevent mental health disorders? I think you have answered, but if there's something you can add, you are free to. A second one.
What are the simple ways?
For us to be mentally well, or what can we do to prevent mental health disorders? The second one, how can we support those with mental health disorders? The last, if I am experiencing the symptoms that you have talked about, for example, extreme fears, stress, and such like, whom can I talk to? Any other question now you can come and ask.
Good afternoon.
Good afternoon.
I'm humbled to see Mr. Nyauche in our church. He was my mentor. I worked with him in General Hospital when I was doing practicum for psychology. So I realized that there are some people, when they are there, I don't know what it is called, whether it's the maniac which goes very high. They strip and scream continually. I was also encouraged by one person I saw there. She was recovered. I met her in town. She was asking for money to buy medication. Now my question is, for how long will these mental people take their medications? Or it depends on their illness. Like that one I saw, she was well, she was walking independently, begging, asking friends to assist us with money to buy drugs. Thank you.
Any other? Or maybe I can respond to this. I think the first one you said has gotten some answers. How can we support how can we support those with mental disorders? Okay. These are people who are living with us. And a simple thing to say is that everybody is mentally sick, except that the degree of the illness is different. Now, how do you support these people who are mentally sick? Number one, if this person is a loved one, show love, number one. Much as they will not appreciate the love that you are showing them, just show it. They will later appreciate it. They see what you are doing. And when they come out of the problem, they will appreciate it. Number two, if this is a person who can be taken to the hospital, take the person to the hospital. And I'm not looking at medical as the hospital. Anywhere, hata kama ni a health center, there are people in those facilities with some know-how on how to manage people with mental disorders. If they cannot do, they will refer. So to us, for us to support them, let's show love, let's not disregard them or despise them. Because when you despise them, they become more aggressive and they can even harm you, because they will not be able to distinguish between harming. Some of them harming you is nicer, wanafurahia kukupiga. I remember mtu alipiga mwenzake, alafu akaanza kucheka kabisa, akiulizwa ni nini unacheka? Ati nimegonga huyo. You see, they get pleasure from even fighting, and they brag about it later on. So love these people, help them get the medical support that they can get, refer them to health facilities. Once they come from those facilities, the illness is not over, it is tamed. Using the drug makes these people become calm. And I think this will answer the last lady who talked. Using the drug calms them down. Sometimes we don't say we are treating them, but we are alleviating the problem that they have. We are reducing the problem that they have. Once it is reduced, they will go back to their normal activities. And when they go back to their normal activities, this is the time that we now need your department, the psychological department, that will be talking to these people about adherence to medication. And to answer your question that how long do these people need to take the drug, I can tell you that they need to take the drug religiously. Kuna wakati mtu anawachaka kuomba. You need to take the drugs religiously if you want to become stable and continue doing your work. Number one, they need to know that they have a problem, and their problem is mental illness. And this mental illness can only be reduced when they take their medication or when they adhere to the advice that they are given by the mental health personnel. So when I talk of taking the drug religiously, you don't stop taking it, like you don't stop praying. Continue taking the drug, in fact, until such a time when your doctor, your nurse, or the medical personnel who is attending to you start reducing the medication. We don't stop these drugs abruptly. We start reducing them pole, and we see how you cope with the reduced dose that you are now having. Until that time when we stop and tell you that you are still expected to come back to the hospital for review, and you'll be seeing how you are doing even without medication. So you don't stop taking the drug is reduced by the medical personnel, and once they are reduced, they are the ones who will withdraw the drug. It is simple, and most of the people are aware that many people have ile munapimwa hapa inaitwaje? Pressure. Watu wa pressure wanawachao kunywa dawa yao. If you leave it, it goes up. Watu wa diabetes, wa sukari, wanawachaka dawa yao. If you leave it, there are some illnesses that we have to live with. That is mental illness. And in fact, when you use the drugs well, nobody will even know that one is sick. I was privileged to train when HIV was coming in. Hata kujua peke yake ya kwamba mtu ako na HIV, tulikuwa tunasemanga that one has HIV. Unapeana report yake ukiwa hapa, as if it could be gotten kwa hewa. No. These people, those who accepted to take their medication, you cannot even know that they are ailing. Same to mental illness. We have to take the medications religiously, bila kusita. Because immediately you see somebody saying that mimi sitakunywa hiyo dawa, that is when they have relapsed. That is when they have come back to their illness. Inawasumbua sasa, kwa sababu ajui kama hii dawa inamsaidia. Sijui kama nimejibu hiyo swali. There is another one. fear. Whom talk to when I have extreme fear? Talk to the trusted person that you have around. Trusted persons are our families. These people are trusted and they cannot harm us. So when they cannot harm us, they are the first people I should tell that I have a problem. Nasikia tu niko na uoga. Number two, if you realize that you have a lot of fear, go to the hospital. Go to a psychologist because they will talk to you and help you come out of the problem. There are some drugs also in the hospital that will reduce the anxiety. Somebody who has fear must have had what we call anxiety first. Mpaka inamfanya anaogopa. So we have those medications in the hospital. And once you start using them, we don't want them to be used in a prolonged manner also. You use them within a given prescribed time, and you will get better. I can see a hand is up there. Yes.
What has been asked by my sister here.
Yes.
Concerning the medication.
Right.
Like you correctly mentioned, that these medications can only be tapered, be able to be reduced in dosages as the person seems to be able to cope and recover. But I also want to tell us that, you see, the thing with mental disorders is that there are a lot of things that that comes into place for somebody to either have a mental disorder or be able to cope with a mental disorder. And we look at it in what we call a biopsychosocial approach, a biopsychosocial approach. That means we are looking not only as use of drugs, in fact, use of medication is only 5 to 10% in helping the client to cope with a mental disorder. Otherwise, the psychosocial support comes in here, because somebody can be taking the medication well, but you have got what you call the precipitating factors, which means the environment at home is not conducive, The person is taking the medication, but is being yelled at home. Are you getting? There's not that love environment that comes in. Somebody is taking the medication, but the food that they are eating is a precipitant to the condition that they have, because they reduce the effect of the drugs. Are you getting? So I take this medication well, but the food that I'm taking is interacting with the medication so that the drug is not working well. So at the end of the day, you are looking at also the diet that this person is taking. You are looking at that environment that the person is growing at. You are looking at all these dynamics that takes place that will make somebody either to cope or recover from it. You see, some of these mental disorders as a result of a medical condition or a surgical condition. So if you don't treat the primary thing, if you don't treat the primary cause, then even if you give the drug, then you are not going to help this particular person. So that is why, but just like Dr. said, that these mental disorders is like having diabetes or having high blood pressure. You really have to take the drugs, but it can be reduced in dosage as you keep on coping. That's what I wanted to ask. Thank you so much.
Yeah, thank you so much. We've worked together with Willis at certain points, so we know one another. Even as I was trying to answer, I did not want even to mention his name, but he has come up, so I have to mention. Anybody else? Yes, sir. Yes.
Somebody who is addicted to camera grow.
Yes.
Women addicted to others. I cannot allow men. For another to such a white grow.
Like myself.
I think that that's the only chance you have. But there are several. But how is blood in such a white? that. How would you get to someone like this? How would you get to this kind of thing? Like when I've been there, I think it's washing up. Wash, now I feel like. So how would you have that kind of thing?
Okay. I did not want to mention the problem, but I have it here. The problem is called obsessive compulsive disorder. Zamani we used to call it obsessive compulsive neurosis. It is also part of the mental disorder, not only when it affects you. Now when it becomes a problem, and how will you know that this has become a problem to me? Like somebody who is putting on the white shirt all the time. Sitaki kuona hata ikiwa na dirt. Nona, that will be there. Depends on the time. If I'm still at home, I can change. If I've left, then I need not to bother about what has dropped onto my shirt. Lakini, you will find that this person cannot even talk to people because his mind is now centered on the cloth. Once it is affecting you, that you can now not concentrate on doing another thing, then it has become a problem to you. For those who are washing their hands, they don't even greet people. Even people, when we were still allowed to greet one another, immediately you greet them, they go and wash their hands. You see, it is not normal. And people will start thinking about, talking about you. Kwa nini nani tukisalimiana? Kwani sisi tuko namna gani? You see, to him, that is satisfying his or her ego, ya kwamba hataki kuchafuliwa na watu. Apart from the time that COVID has come, when we are being told that you can contract COVID-19 from greeting one another, we were greeting ourselves normally and it was not a problem. But when it becomes a problem, once it starts affecting your life, to the extent that you now avoid greeting people because mkono itachafuka, then you now have a problem. You become obsessed with it until anybody else ukimwona unaona ni kama shida tu. Kwa sababu ukisalimia watu, you will be sick. Ukisalimia watu, you will infect yourself. Unaona? So, it becomes a problem when now it has become part of your life. It becomes your routine that you don't greet. You look like it since morning. Kama nguo yangu imeingia tu hata madoadoa kidogo, sasa I cannot concentrate on what I'm doing. I must go home and change because I do not want to see a stained cloth. Once it starts affecting you, it makes you not to do your normal routine, it becomes a problem, my friend. I'm not getting you. Willis wants to respond.
I just want to add, before you respond on the remedy,
yes,
because this is also my area of expertise.
Yes.
Before you respond on the remedy, I wanted to say that, Emmanuel, there are some things that we also need to understand. Before I bring in the point that Dr. has said. You see, we have what we call a personality and a personality disorder. There are those of us who our personality demands that we are perfectionists, you know. I cannot repeat a suit, you know, every other Sabbath, you know. But there are those of us who don't mind. Are you getting? There are those of us who our personality demands that when we put on a dress, we put on a hairband that matches the dress, and of course, something that matches that. It's our personality. There are those people whose personality demands that they remain quiet. So even if they have a question to ask, like now, they cannot ask it. Are you getting? But deep down, they have a question to ask, but they can't do it. Like some of us here, they are here. Are you getting? But it's their personality to become reserved. But there are those of us who cannot sit down. Are you getting? Like me, I've stood twice. Are you getting? That is my personality. I'm just saying that. Now, Dr. is saying that we can only be able to define a mental disorder. We have got what we call a Bible or a reference guide that we use to classify the mental disorders called the DSM-5, you know, the Diagnostic and Statistical Manual for Mental Disorders. And what Dr. is saying is very important, that it can only become a disorder when, number one, you cannot work. You don't go to work because you want to check your dress. You know, there are those people who get late to work just by checking their dress. So by the time they get out of the house, it is already 12 p.m. and the entire wardrobe is upside down. Are you getting? That is a challenge. That now becomes a personality disorder. Number two, if you have a social problem, you know, you don't relate with the people and you concentrate in washing hands, that also makes it to qualify to be a disorder in its place. But we also have the duration that this has taken. If it is only once in a while, for example, it's once a month, or for example, it's occasionally, it is a personality, it is not a disorder. But if it has lasted more than 6 months, that for the last 6 months, this has been your behavior, then eventually we are saying that you have a personality disorder, or for example, you now have a mental disorder. If it is a personality disorder, we call it obsessive compulsive personality disorder. But if it is a mental disorder generally, then it just becomes an obsessive compulsive what? Disorder, just like Daktari has said. Now, what we need to do now is what I want Daktari now to come in, because that is what he wanted to ask. Then probably we can also respond. Thank you.
Thank you for the input, sir. The remedy. Or you want to ask another? Yes.
Now, in a scenario where the person who has this personality disorder maybe will not realize that he has a disorder. Most of the time, if you are approached to help, they tend to take offense. Because with them, they are saying they're feeling normal, they think that they are okay with everything. So in such kind of scenario, how do you help?
Okay. The remedy for these problems, I've heard you are being called Emmanuel. We have therapists. There are those who are called psychological therapists. They take such people through a system where they talk to them until they realize that whatever they are indulging themselves in is not normal. And they give them a way of coming out of the problem. They talk to you until you realize it is a problem, and they prescribe for you, they give you activities that you are supposed to concentrate on doing until you forget about doing what was causing a problem to you. As my friend has rightly said, whoever is doing this does not realize that it is a problem until somebody else is offended. Let me use that word. That so and so the way he's behaving or the way she is behaving is not normal. And when it is not normal, how do I help this person? The way you can help the person, just love the person first. Help the person become your friend. Talk about the thing. When you talk about the problem that they are now having, you see, some of them may have known, but they don't know how to come out of the problem. You can refer to a therapist, you can refer to a psychiatrist, and when you refer to a psychiatrist, they will use the medication. And when they use the medication, some of these drugs, Willis knows better. In our brain, we have what we call the neurotransmitters. And these neurotransmitters, they are the ones that make us behave the way we do. Simply, when they are overproduced, you will find some people reacting loudly. How do they react loudly? They tend to do things haraka haraka. Not even screaming, they react very fast. And when they react very fast, their reaction may not be in a normal way. Some don't even tend to react. They just stay put. They don't even ignore. They don't know they're supposed to react. And when these things are produced in less numbers, when they don't reach the normal way, this is the person that we say will go down, or this is the person that will tend to take time to respond. When they are overproduced, these are the people who will do things very fast, reacting very fast, talking very fast, and you cannot even correct them. Giving them the medication will restore sanity. It will bring the thinking or the behavior to a normal level. And when I talk of normal, I don't know the normal of anybody, but whatever is common with everybody, that they can now do things the way I do, the way you do, the way the other person does. It is the drugs that will make him not to overreact. It is the drug that will make him come from slow action, and they do things normally. So that's when you go to the psychiatrist. The therapist, they call them they call themselves psychological therapists. Or in the hospital, we have people who have even done medicine, and later on they go and do psychology. I'm forgetting the word. But the clinical psychologist. After taking a course in medicine, later on they go back and take a clinical psychology. They are best placed that you talk to them and they will talk to you and help you come out of the problem. Once you come out of the problem, they will help you to maintain. And once you maintain, you see, you now don't have a problem. So that's how the remedy can come out. Through the drugs, through the clinical psychologists. There are others who are calling themselves the psychological counselors. They also do the part they do. Maybe to, yes, sir.
We have what we call systematic desensitization. That means that we want this person to take a record, have a record, for example, that how many times today have you washed your hands, for example. Then we want them also to taper it off. Tell them, now that you have washed 4 times, can you try to wash, for example, twice today? Then you tell them, what did you experience by washing twice that was different from when you washed 4 times, for example? They tell, I felt nothing. I felt nothing about it, actually. So then you realize it's just the issue of the mind. Then you tell them, why can't you now try and wash once, for example, today? Then you realize, what did you experience when you washed once compared to when you washed twice? They'll tell you that I've experienced nothing. Then therefore you conclude that for sure, behavior that is learned is a behavior that can be unlearned if it is not causing anxiety. The second thing that you can do, we have got what we call the token therapy, the token economy. That means you congratulate them with words, but you also have an opportunity, if this is an adolescent or a teenager, you also have an opportunity of giving them a gift. When you give them a gift that now you washed yourself 4 times, you washed yourself twice only, but not 4 times, I just want to congratulate you for what you've done. Then you give them a gift. Then from that gift you realize that any behavior that is rewarded, it is reinforced. Are you getting? So anytime they know that I don't do this, Daddy will give me something. Anytime I realize that I do the right thing, Daddy will give me something. So that's what we are saying. Or we are telling them that now that you've washed 4 times and you keep on washing 5 times, I want to punish you. The punishment is you reduce some privileges, for example, that you give them. If they have a journal of that which they did, and for example, they are telling you that each and every week you give them, for example, you have a girl, I give you 100 shillings for airtime. But because this behavior has persisted, I want to reduce it to 50. Then they will tell you, when it is reduced from 100 to 50, I'm losing something. Then we realize that any behavior that is punished, it is not done again. So those are some of the things that we can do. But eventually, the best thing that Daktari has said, that if it is persisting, then it is the issue of the brain, and sometimes it requires drugs, low dose antidepressants. Yeah.
Thank you so much. And to add on to that, there is a question that may crop up, according to what Daktari has said. We have those who are waiting beds, and it is a problem. Based on what Daktari has said, you reward the good deeds. There are those people who have been beaten, caned seriously because they are waiting the beds. Lakini hawajawacha. Now, talk to them. Sometimes they are brought to us up there. We just talk to them. And you tell them, thank you for not doing that. Wengine, and the mothers, I chose to do that to one of my girls. Amepigwa, amechapwa, amekanyagwa na mama yake. Ati hata mtoto mdogo akojoi kwa kitanda na wewe unakojoa kwa kitanda. Nikamwambia, waachana na huyo mtoto. Wacha akojoe, hizo vitu zitaanikwa. Now I decided to talk to the girl. Mama, shida gani unakuaga naye? Ati mimi nastuka tu. Nikamwambia nitakununulia nini? Saa. Na uweke after 2 hours unaamukaga kuenda choo. Na hiyo saa itakuwa yako. If you manage to do it the first day, itakuwa yako. Saa iko ni nini? Ni simu. Imekaa hapo, anaamuka kila siku kwa sababu anataka simu ikuwe nini? Yake. We didn't give the girl medication. First, I told her, congratulations for passing the exam. Ukifanya hivyo siku 3, saa zingine inakuja. Ikikuja sasa nasema, pole baba. Nilistuka ilitoka. Naona. Sasa anaona ni mimi amenikosea, lakini mimi namwambia, no, hujanikosea. Mimi nilikubali uendelee tu kukojoa hapo, tutaanika hizo vitu. Na mama hataki kusikia hiyo. Later on, when the girl succeeded, nilimnunulia simu. Simu hiyo kuna mtu anatumia. Akienda shule, akirudi, anaripoti ya kwamba ilifanyika mara moja tu kwa shule. Naona. But it was a problem. Hata anawekwa alale chini, sasa hawezi lala juu sababu watakojolea wengine. So appreciating once they do something good also is very much helpful. Thank you, Daktari. If there is no burning question, yes, sir.
I briefly want to comment something. I does not work with the medical department. There is this motivation about what we call procrastination. This refers to not only steal time, but to probably manage time. As we have seen so far, so many people cast the day due to their physical predicaments. There is one of the presidents in a certain country who was born with an inborn disease and eventually was thrown out as an outcast. Eventually, the missionary families came out and actually finally became the president. At this, we have seen some problems in ourselves with the stress. It's very difficult to avoid. And as we have learned with the case of motivation, is that we does not want to call somebody useless because he was born with a reason. Yeah. And as we want to conclude this, is that as the doctors have said here, that some children are born with weak sphincter muscles, and now they cannot be able because of such reasons, and the parents, some of the parents does not understand to give the medications for these children. Actually, what comes on our way when we have a stress factor is that there is this problem of psychoneuroimmunology, because there is an interaction between the brain and the immune system. If the brain has a problem or the immune system has a problem, it is not contracting to each other, because when you are eating, there is the brain controls you that now you have taken enough food. But if you have a problem with the brain, the person will not be able to know whether he has taken enough food. So you see, there are some obstacles in life. As Christians, we are challenged to think through difficult points of excuses. Thank you.
Thank you so much. I'm saying there is nobody, we can stop at that point. Thank you, my brother, for the input. And I'm happy about what you have brought up. We have so many examples that can be given. And we have many experiences that we can say. It's only time that can make us not to say them. But I told you I was once a victim of tea. I was so much addicted to tea. I was living in Mandera until one day I decided to say that I cannot be a slave of tea. Hii ni chakula na mimi ndio ninatengeneza. I avoided and took porridge. Can I tell you that ilifika saa 8 ya usiku nikaamuka. But the unfortunate thing that happened to me, and I used that to counsel people, nilibaki na maganda moja ya kiberiti. Na nilikuwa na gas yenye lazima uwashe na nini? Na kiberiti. Do you know what happened, my dear mothers and sisters? Nilipogonga tu hivi, ilikatika kwa shingo kama hapa. I did not get that one. Na hata kama ningeipata dada yangu, utashika waki ukiwasha moto. Can I tell you that nilienda kulala na usingizi haikukuja mpaka saa 11. Wasomali huko saa 11 wanatembea ni kama imefika saa 3 mchana. Na kuambia saa 11 nilipolala, saa 12:30 wakati duka inafunguliwa nichukue kiberiti, it was like coming from morning to evening. Then I said, T, I cannot be your servant. I can take you when I like. Thank you.
What do you say to our brother Walter? Yeah, we thank you for taking your time, being patient. I know it has been a very busy week. We have had so many activities. We have learned a lot. It's now our responsibility to take into action the things that we have learned. The only treasure we have is our body. And we have said that our bodies are the old temple of God. So let's take care of them. Otherwise, have a peaceful week, and God is blessings. Thank you.